Cora, I'm glad we're getting to chat again.
Hi, Noah.
So I hear the big news over the last few days is that Alberta is going to offer vaccine off-label for kids.
Yeah, so this is indeed our big news this last week. This week actually was recommended that children 12 and older who have chronic conditions, and these are defined the same as the adult chronic conditions. So chronically ill children can go ahead and have the Pfizer vaccine in an off-label fashion, which means that even though Health Canada, the FDA in the US are looking at this, and this is put before them, this is not authorized yet, but experts believe it's safe and effective enough to go ahead and make this recommendation.
So I guess as clinicians, we prescribe things off-label all the time, right? Like, we don't always stick exactly to what was done in the randomized trial because that would really limit us in terms of helping our patients. Is that the same here?
Yeah, and we know that these clinical trials that were done on a large scale, but quicker than the previous ones, that's exactly what they missed, is having these specialized populations like children in them. Therefore, they hadn't been included in those initial trials, so other studies have to be done. Pfizer did report that their study in this particular population seemed to be showing high efficacy of the vaccine with no safety concerns.
And so based on that, Alberta said, all right, let's give it to all the kids. Is it all the kids?
Yeah, so this is an important distinction. So first of all, NACI has supported this age group to be vaccinated before, and I want to say that. And what it is for children who are chronically ill, who have special conditions, and those are all listed in Alberta. And what I want to outline here is that this is not for every child, and I would even argue it's not for every chronically ill child. It's for the ones who are struggling with a chronic illness, in whom this is a severe illness, who this is recommended for right now.
Got it. So like, why now? Why was the like why did they do this?
Well, so a few things. As you well know, Alberta is experiencing the largest number of active cases of COVID we've ever had in our history. So, and we're seeing a change in the epidemiology. We're seeing younger people in ICUs and hospitals. And we're also hearing a lot from these families about how in the last year they've lived in severe isolation. They have lived with so much anxiety. This has been such a stressor, all this to try and keep the child safe. And this is a chance to give these families a bit of a reprieve.
I can totally relate to that. I must say, like, for my patients that I really worried about when they got vaccinated, I felt as their doc, like a load off my chest. I can't imagine how their families members felt,
And for you as a family doctor, this is interesting. I'm a pediatrician, so obviously I'm interested in children as my primary focus. What's your take on this? What do you think the impact is on the rest of your practice?
Well, I mean, so if this came out in Ontario the same way as Alberta and we were asked to write letters, I know that it is likely that all of my families who are well connected and well to do are going to advocate for me to write letters for their kids. And those may not be the same families of the kids who most need it. And at the same time, I'd be thinking about, even those kids who most need it, do they need it as much as some of my patients who are still waiting for their second dose? And who seem most likely to die in this pandemic. I feel really torn about the whole thing, and I don't envy the decision makers at all. It's a really tough spot. I just can't wait until we're in a position over the next few weeks where we're not so strained on our supply, when really, it's not going to be about, well, this person or this person. It's going to be, let's get them all going.
Yeah, it would be a different discussion if availability wasn't an issue.
So if you had to counsel some of our colleagues around, how to respond to those parental requests, oh, can my kid get the letter? How are you telling people to handle this?
Yeah. So again, I just want to outline this is not for every child. It's not even for every chronically ill child. It's for those families in your practice that you feel have been really impacted by this pandemic and whose children would benefit from being vaccinated a few weeks earlier, because this is what we're talking about really. And to say that this is an off label use, but we have done that before, and that this comes with recommendation from the province and also support from NACI. And if they think that for them, taking the vaccine earlier is going to help their family and help their child, then they can go ahead and make that decision to do it.
As a family doc, I have this list of people that I really worry about, families and kids that I really worry about. This is a chance for me to do something for them. So in that sense, it's kind
Exactly.
of nice.
Exactly. That's exactly it. I think that's how you should approach this, is think who in your practice would benefit the most from it. And you probably know them well enough that you can help them as they're making that decision, and then help the ones who would like to make this decision, who want to have the vaccine, but who probably are not the best candidates right now because of all the issues with availability and equity that you pointed out.
That's perfect. Okay, we'll talk again soon.
Okay. Take care.